With stroke, time is brain. The sooner we identify strokes, the sooner we can offer time-dependent treatments. And in Mrs. Holmes' case, that was exemplified by the fact that she had providers that quickly identified stroke symptoms.
I am on the board of the Daughters of the Republic of Texas. And so our board meetings are typically in Austin. So about every 4 months, I would travel to Austin for the board meetings. I looked at my gas tank and I had about half a tank of gas. Well, that would get me to Austin, but oftentimes I find that it's sometimes difficult to find a gas station in Austin. So I thought, well, I'll just stop here at the Chevron station on 1488, which was very convenient. There was a man that was exiting the doors of the convenience part of the store. And he came out and he came over to the car and he said, you're going to have to pull up and pull back because you're not lined up. You can't even get to the tanks where you are. And I thought, oh, okay. So I did that. I was able to maneuver back into where the tanks were. And so then he came back over because I was having trouble getting out of the car. Now I have a little BMW that's small, and sometimes it's a little bit hard to get out. But it was like my whole left side was like weighted, and I just could not lift it up to be able to get out. And he said, are you having problems? And he took me through some of he explained that he was a retired Houston Fire Department personnel, and he had noticed that I was having some difficulties, and he thought that perhaps it was a medical emergency. The point that I realized that there was something going on beyond what I could control was that my left hand started losing feeling. And so I started, working at trying to bring the feeling back into it. And it wasn't happening. It just seemed to get deader and deader. And then I started, my speech pattern was askew.
Well, when initially we got there, we did our normal stroke exams. We checked for, grip strength and symmetry. Everything was okay. We didn't notice anything that stood out at that point. Her heart rate was fast. It was in kind of an irregular rhythm. We were trying to also get her to go to the hospital. At this point, I don't think she thought anything was really going wrong with her. She didn't want to go, so we had to kind of have that discussion and tell her the different reasons why we thought it was important for her to go to the hospital. And en route, maybe a minute or two into transport, while I was getting the IV, she just stopped talking to me. And then I looked up and I looked at her face and she was drooling. And the left side of her face was, drooping at that moment, and she was gazing off to her right side. Once we noticed that she was definitely having a stroke, we upgraded traffic and we took her to St. Luke's Comprehensive Stroke Center.
Well, Mrs. Holmes had a very unusual presentation. She initially presented with cardiac symptoms, and MCHD, with their excellent training, MCHD quickly identified that the patient was having an acute stroke. And they quickly transitioned gears from heart issue to now a brain issue. And they were able to mobilize us, and they informed us with pre-hospital notification through this new system that we're using called Pulsera. It was able to communicate with us that they're concerned that she was having a stroke due to a large vessel occlusion or a big blood clot in the brain. With their pre-notification, we were able to quickly mobilize our radiology services and obtained advanced imaging that confirmed that she did have a large stroke. She received our IV thrombolytics. We used tenecteplase, and this works to dissolve blood clots in the body, and we were able to get that within less than 40 minutes of her stroke symptom onset, which is very profound. At that point, because of the nature of her stroke, we knew we had to take her to the cath lab for clot retrieval. And we were able to do that very efficiently. And she actually had 2 clots, one big clot in her middle cerebral artery and a second clot in her anterior cerebral artery. So I was able to remove the middle cerebral clot very quickly, and then worked to remove the second clot thereafter. And thankfully, both were successfully removed. She now has a full recovery because of the quick actions of MCHD, the St. Luke's Comprehensive Stroke Center, and just all the teams involved.
In this case, we responded immediately as soon as we had the call. Our local fire department was already on scene, and the district chief at the time had also made patient contact and was giving us a patient handover report on our arrival.
Having, Nick there, I also had another person in the back of the ambulance. So while I was busy ensuring patient care and making my assessments and getting those large bore IVs that they're going to use at the hospital, he was able to use Pulsera and notify the doctor in advance so that they could prepare everything on arrival to my understanding, create a very fast door-to-needle time, which ended up being quite successful for the outcome of our patient.
I could not have asked for more attentive nurses and the doctors, even though there were several different doctors that treated me. Of course, Dr. Bozorgchami was the one that did the surgery, and he was very patient, explaining to me what had happened and how I had been treated. And they were really wonderful. The quickness of the ambulance and the fire department, it was just the right place at the right time. And when they asked me where I wanted to go, I did tell them St. Luke's, because my husband had been there about 2 months earlier for an ER visit, and I was very impressed.
St. Luke's, the Woodlands Hospital, is a DNV certified comprehensive stroke center. And that means that our stroke center works the same, whether it's in the middle of the night on a Sunday or on a holiday or normal business hours. And we work the same 24/7. This means that we provide the whole arsenal of stroke care to all our patients. And we do this very efficiently with strict protocols in place to ensure that we give the most optimum patient treatment at the time of their stroke.
St. Luke's Comprehensive Stroke Center really helped with the process of healing for me.